takeaways for the new healthcare experience. My name is Marilyn Cox. I'm the marketing principal with the Oracle Marketing Cloud's Industry Solutions Center of Excellence. I've included my contact information. If you have any questions regarding any of the content reviewed in today's presentation, feel free to reach out. I'd be happy to chat or clarify further. So here's how we begin to define the new healthcare experience. Looking at the stages and the desire to better listen, to align, to engage, to measure, and to take that understanding and create a greater connection and drive it into a singular profile is really where a lot of organizations are focusing efforts when it comes to the new healthcare experience. Patient-centered full continuum care management continues to be an objective for many organizations. These healthcare organizations recognize that they must focus on the entire care management life cycle. And to do this, they must target communications around healthcare offerings. For example, there was a company that started a marketing campaign to target women aged 30 to 50 for their cosmetic procedure. But shortly after the campaign launched, the company recognized a better target for their procedure is males over the age of 65. Organizations must also extend this lifestyle focus and care management content across multiple channels. Google Think surveys found that 76% of patients were using hospital websites for research, compared to 32% using TV, 20% using magazines, and 18% using newspapers. Of patients who found physicians and private practices on their mobile devices, 44% scheduled an appointment. Year over year, the number of consumers using mobile devices to search for healthcare services increased by 22%, and 52% of smartphone users gathered health-related information on their phones. It's imperative that healthcare organizations understand what content should be delivered to each audience segment and across the appropriate channel. As we heard in the previous slide, patients are leveraging social, and so are physicians. It's necessary that organizations try to make the social digital connection with physicians. And this is a great example. Providers use a tool called Figure One for a photo sharing app with other providers. Like Instagram, it allows providers to share cases anonymously and get provider feedback. And I think the following quote summarize the requirement around social media connection nicely. So as this states, social engagement is no longer limited to the major channels like Facebook, Twitter, and LinkedIn. To meet regulatory risk concerns, some organizations are building their own social platform that physicians can use to self-educate and then engage with one another. You can't control the conversation, but you can be a part of it. Utilize your advocates. Be authentic. And remember that response is important. Not responding to a social post is like not answering the phone. Some of our biggest mistakes were underestimating the volume as well as the commitment around the activity required. Develop a digital scorecard, measure engagement, evaluate the volume and response, and begin to understand the sentiment around both your organization and your competitors. Align with your physicians. Help them understand today's healthcare environment. Jackson Healthcare adopted a give more than we ask attitude, which really resulted in strong physician relationships and an engaged community. With marketing automation technology, you can really better emerge as a thought leader. Survey and identify trends amongst physicians. Drive community development. Recognize the best practices and successes in your community. Engage by giving more than getting, and connect with research and proven best practices. Optum cracked into the C-suite through smart content marketing. They have achieved what many organizations struggle with. They have successfully engaged with the C-suite. When launching their new accountable care solution, they revamped their content marketing efforts. And by identifying and mapping their content journey, Optum has connected and engaged with key decision makers by delivering the information they're most interested in. And they've done this through using a smart form strategy. By developing a unified content journey consisting of 6 pieces, Optum established themselves as a trusted advisor in the arena of health reform. Optum has also focused their content efforts. They targeted their content on organizations that were chosen by Medicare to participate in its Pioneer ACO pilot and its Medicare Shared Savings Program. These efforts resulted in a 700% improvement in sales accepted leads for Optum. Monitor physician relations and the advancement of hospital strategies, and really understand physician activity. Healthcare organizations are working to access a 360-degree view of their relationship with the physicians. Organizations should track all activities related to the physicians, their affiliations, issues, comments and preferences, and their referrals. This information should be captured within CRM systems, but also passed into marketing cloud technology to dictate segmentation and personalization. By capturing the explicit and implicit information, so the explicit information being that demographic information, and the implicit information being that digital body language, that digital engagement, across the integrated systems, organizations can monitor the performance of physician liaisons and referring physicians by viewing reports and dashboards. Analyze this data to understand how liaison activity is leading to referrals and commercial value. As quick as the patient wants information and feedback, physicians want it faster. More and more physicians are using their mobile devices. Clinicians are having text conversations with other physicians via their mobile devices. You must also commit to understanding the needs of the patient in both content and content delivery. For example, don't overemphasize the value of videos. Healthcare wants to build a video for everything, but videos don't engage the patient. Videos are often boring and disenfranchise the patient. It's very important that you understand who your audience is, what content resonates with each, and what channel each prefers to receive that communication on. Support your decisions with data. Healthcare organizations can finally obtain that data insight to make smarter business decisions. By capturing and analyzing an individual's digital body language across all channels, companies can not only develop that sought-after universal profile, but also understand things like cost of recruitment efforts, cost of acquiring new physicians, and effectiveness of their communication outreach across regions. Organizations can also begin to understand revenue potential. You can see programs that are not only driving the most engagement, but are also driving the most revenue. You can begin to understand which resources have the greatest potential to grow revenue and which are generating the greatest return on investment. In short, you can identify which resources and programs to invest in. Through the development of strong content, unification of digital channels, and focus on data forensics, healthcare organizations can grow revenue, increase quality without sacrificing volume, recruit and retain physicians, and make strategic business decisions based on fact and not just opinion.